I'm here today with Professor Stephen Timmins, an expert in health technology and a previous healthcare manager. Stephen, you're actually now involved in your academic role in the distribution of merit awards to eminent consultants, and that they obviously get the big pay rises based on some of the projects and achievements in the course of their everyday work. What kind of things can people do early on in their careers to set them on that kind of trajectory?
Okay. I think I should say at the outset that the official term is Clinical Excellence Awards, but they're awarded against five criteria, and one is about providing excellent care. And I think the important thing is how do you show that you've provided excellent care. The second one is about developing new and innovative services. The third one is about leadership, and now the system takes a very broad view of what leadership might be, but having some kind of leadership role, be it clinical, academic, managerial. The fourth category is research. So again, what is important is the research projects, the impact that that research has had on practice. And the fifth category is education. So what these doctors have done in terms of their work with the medical royal colleges or with medical schools. So I should say clinical excellence awards are very hard to get. There's only a very small number given out nationally each year, and they're designed to reward the consultant physicians and surgeons who've done the most for the NHS and really gone well above and beyond what it is they're contractually expected to do.
Wow, that seems like quite a daunting list for someone who's training in many aspects of healthcare at the moment. Do they have to excel in all of those things to be eligible for one of these awards?
No, at the kind of lower levels of the award, the system is looking for certainly activity in all five, but not necessarily excellence in all five. For the very highest level of national awards, which are known as platinum awards, yes, it would be a case of excellence across all five, or certainly 4 out of 5 criteria. Again, it's a very small number of doctors who are actually even eligible for those kinds of rewards. And having looked at the applications, their achievements are pretty impressive. But it's not necessary to achieve at that sort of level to be in the system.
Okay, and that's for doctors. Is there an equivalent of clinical excellence awards for other professional groups?
It's not done as formally, and there's not a national NHS scheme. Local trusts will have their own systems for recognising excellent practice across a variety of healthcare professions. It is acknowledged as one of the shortcomings of the scheme that it's only consultants, physicians and surgeons who are eligible, and it has been pointed out more than once that it would be good if there were a system for other healthcare professionals, many of whom are making contributions of equal value and importance, and they're not always recognised as systematically as they might be.
Okay, and is there any moves towards that kind of activity in the future? Do you think that there's changes in the career development of nursing or physiotherapy or pharmacy to kind of recognise excellent practice like that?
I don't think there's not any kind of current policy initiatives, given the nature of the healthcare workforce and given the kind of global crisis in terms of recruitment and retention of healthcare professionals. It's something that I certainly think the NHS at the corporate level should be thinking about and looking at much more seriously as part of a wider range of packages to ensure that professionals of all groups are appropriately rewarded and recognised for their work.
Okay, and a final question. So if you're just entering into a healthcare profession and you're quite an ambitious person, what kinds of things do you think you can do early on in your career to make yourself stand out against, quite a often, highly qualified bunch of peers?
I think one of the things that, and again, this is for all healthcare professionals, is to get involved at the local level in either small research projects or in processes of clinical audit, or to get involved in quality improvement projects. And if it's possible, as part of doing that, to be able to produce some evidence, be it a paper or a guideline or a policy, to actually show that you've done something and that it's made a difference to practice. And those kinds of opportunities are actually available to people very early on in their careers and across the whole range of health services and professions. And people who are looking to have something a bit different, a bit impressive on their CV, my advice would be to get involved in something like that at an early stage, because it's often those are the kinds of things that are looked for in terms of promotions or new appointments, to see, well, what's different about this person? What else have they got to offer?
And those kind of opportunities through your colleagues, through senior peers, through consultants, through other members of the team.
Yeah, there's plenty of opportunities. I think it's often just a case of asking. Right? If you've got an idea, say, can I do an audit? Can I do a little project? Most people will be delighted that someone actually wants to take on something like that. And well, yes, it is extra work, but it could be a great investment in terms of a career.
Excellent. Thank you, Stephen.